Hi, everybody. This is Jen Anderson of Anderson Physical Therapy and Wellness out of Denver, Colorado. And today I wanted to share with you some techniques that you can do to help relax the jaw and the head if you're having TMJ pain or jaw pain. I had jaw surgery my senior year of college, which was a lot of fun, and ended up having pretty severe right-sided facial pain for about 6 years after that. So spent a lot of time taking courses and learning techniques to help people that have jaw pain, and then using those techniques on myself to make myself feel better, and it worked. So they're tried and true, and so I want to impart some of this knowledge to you. So one of the first things that helped me so much when I was recovering from my jaw surgery was seeing a craniosacral therapist. And that person was the first person to ever put their fingers in my mouth to massage my jaw muscles, and it made a huge difference for me. So I'm just going to show you some of those techniques that you can do. When I would usually do this, I would massage the inside of my jaw when I was driving in my car, but a lot of times doing this like before you go to bed, I think can maybe help relax the jaw and help with grinding at night. And another place that's really good to do it is in the shower, because you can drool all over yourself and it doesn't matter, and you've got warm water pounding you on the head, which feels really good. So the first muscle that we're gonna get is called the lateral pterygoid, and that is just right in front of this part of your jawbone right here. So best way to access this is you're going to take your finger, and so I'm going to work on my right side. I'm going to take my left index finger, slide it along the along the top molars until I kind of run into that dead end. And then I want you to do little sweeps out towards your ear. And it might be really, really sensitive in some of you. So just be really gentle. Go in there, do a couple sweeps. You can always come out and then go back in and do it again. And oftentimes when I do that, I feel like the second time it's a lot easier. So I'm just going to kind of show you what that looks like. So make sure your nails are short, wash your hands, get gloves if that makes you feel more comfortable. So sliding the fingertip along the top molars, or dead end, and then just little sweeps up in that corner. Okay, so that's lateral pterygoid. The next one we're going to try to get is masseter. Masseter is this big muscle here that lets you clench. You've got a superficial masseter and a deep masseter. Deep, you get trigger points and tightness in that superficial masseter more towards the front of your face. Deep is really strong muscle and you get a lot of trigger points in it. You might feel a lot of like knots, tension in there. Again, be gentle, start slow, and then you can always kind of get more aggressive as you do this more frequently. So what you want to do, what I'm going to show you right now is a sweep. So we're just going along those muscle fibers from our top cheekbone to our bottom cheekbone. Okay, so I'm going to start more superficial, more towards my mouth. And then I'm going to work more towards the back. And you can even do like a little bit of rubbing, like up at the top along your cheekbone or down at the bottom along your cheekbone. Another technique you can do is like if you find a knot on that side, you can take your thumb on the inside of your cheek and your index finger on the outside, and you can pinch it and hold it. So it's kind of like this. You can even like kind of drag across those muscle fibers. So here I'm going to show you how to drag. and you might be sore after you do this, which is okay. You know, you just don't want to be too sore that you can't talk or eat your lunch. So be gentle with yourself when you start. Another nice piece to add into this, your temporalis muscles, these muscles up on the side of your head here, those all help elevate and close the jaw. So if you're grinding a lot, these muscles get overworked too. So taking like your fingertips and just working all along there, you'll find tightness. So I'm just trying to glide the skin over basically my skull. You can do a little back and forth, kind of like shake it out. Kind of work back a little bit behind the ear here too. This can get really tight and sensitive. Make sure you do both sides. And another thing I like to do is work the suboccipitals. So the suboccipitals are right at the base of your skull here. One technique I really like for myself, I take my thumbs and just work right along the suboccipitals. Work along the whole ridge. So more out towards the ears and then come in. If you find a tender spot, you can hold it. You can even give yourself a little traction here, so kind of pulling, hooking your thumbs underneath there and pulling your skull up towards the ceiling. So give those things a try. Feel free to kind of play and see what you notice. Do both sides. Sometimes one side will hurt, but it could be the other side that's actually causing that pain. So make sure that you play and massage both sides. I hope this is helpful to you. Please let me know if you have any questions. You can leave them in the comments, or if you have any other topics that you'd like me to cover, please let me know. Have a great day.